Today in series of Docplexus scale interviews, we have with us Dr. Sachin Chittawar, who's an endocrinologist practicing in Bhopal. He obtained his DM Endocrinology from AIIMS, New Delhi. Dr. Chittawar is also an assistant professor of medicine at Gandhi Medical College, Bhopal. He's a member of the Endocrine Society of India and Indian Society of Pediatric Endocrinology. Thank you, sir, for this interview. So let's begin with the first question. So Dr. Sachin, can you explain the association between neutrophil lymphocyte ratio and diabetic nephropathy?
It has long been studied. There is an association of inflammation and type 2 diabetes. We have seen so many markers like interleukin, interleukin 8, tumor necrosis factor, but they are research tools, not accessible to common public. That's why we decided to look after association of the usual markers of inflammation like neutrophil count, lymphocyte count, which is routinely done in all kind of hospitals. So the ratio of neutrophil and lymphocyte ratio was found to be significantly associated with the early onset of diabetic nephropathy. That is something which has been validated at so many places all over the world, and we have also validated this at our center at Bhopal.
All right. So doctor, moving on to the next question. Can neutrophil lymphocyte ratio be used as a novel marker for diabetic nephropathy, retinopathy, and coronary artery diseases in Indian type 2 diabetes patients?
Yes, it can be. It appears to be a very cheap marker which is easily available, and it can be done by everyone. That is something good about it. And seeing to the morbidity and seeing to the complications which are coming up with diabetes, that is retinopathy, neuronephropathy, we need to look for something new which is cheaper and easily accessible. So if you see from that point of view, definitely it is useful. And with respect to cardiovascular illnesses also, there are so many studies which have been published till date.
Okay. So my next question is, what are the common sleep disorders that are associated with type 2 diabetes, and what is their impact on glycemic and other metabolic controls?
It's a very pertinent question. Right now, seeing to the morbidity of obesity in India, it is going to surpass type 2 diabetes. So in majority of the times in future, you will see obesity will be the cause for diabetes. And when you see this, these people have a tendency of getting sleep disorders like sleep apnea, narcolepsy. They tend to sleep while talking, while reading, or during their, usually when they were not falling asleep actually, and they have disturbed sleep during the night time. And that is actually creating problems with respect to hypertension, coronary artery disease, insulin resistance, onset of type 2 diabetes, mental problems, memory loss, and there are so many issues. So we should actually take care of sleep disorders, and type 2 diabetes is a budding concept in India, and there is a lot of work. Recently we have published one review article on this, and which actually validates it that there is a need to act fast in this field.
So doctor, what are the preventive and therapeutic strategies to tackle sleep disorders in type 2 diabetes patients?
See, you need to go by the laws framed by all diabetologists all over the world. That is, you need to do regular exercise, you will have to be very particular regarding your diet, and weight loss is the crux of therapy. Go for regular exercises, do weight loss somewhere around about 10 to 15 kgs. It will improve your diabetes, it will improve your sleep disorder. Indirectly and directly also you will be benefited a lot.
Okay. Thank you so much for the interview. It was a pleasure having you here.
Thank you.